can long-acting injectables improve the outcomes in adolescents and young adults with HIV? Adolescents and young adults with HIV have the lowest rates of retention in HIV care and poor adherence to antiretrovirals when we compare with adults. This correlates with worse clinical outcomes. There are many features that impact on the compliance. Physical and psychological development, fear suffers stigma and disclosure, lack of perception of health risks, and need for social support. Long-acting injectables have an added value in populations with difficulties receiving daily oral medications. There is relevant evidence from clinical trials from the MOCA trial and the real-world evidence showing that long-acting treatment with cabotegravir rilpivirine was effective, safe, and convenient. Even if pain was the most common adverse event, a great majority of adolescents expressed their preference to maintain long-acting treatment because it improved their quality of life. Long-acting PrEP is also convenient and acceptable in this population, and we know that the prevention depends on the PrEP uptake. So, adolescents and young adults are a core population that benefit overall from long-acting treatment options. It is important that we, healthcare providers, discuss with them all the options because it has a direct impact on the outcomes and will benefit the future of the epidemics.